the topic tonight is to talk about this spectrum of disorders that we're finding in kids, and it's in adults as well, but I think most people are really concerned about what's happening with the kids population. ADD, ADHD, autism spectrum disorders. So we're going to talk about that. My name is Dr. Rob Lindsay, and just a little bit about myself here. I have a great wife, Denise, and we have 3 boys who, at this point, as far as we know, they do not have attention problems. But I'll tell you that I believe one of the reasons is because they eat well. We eat well, they eat well. And I see a lot of kids at our church and in our community who they're not eating the same things, and frankly, their kids have really bad behavior. And I can't help, knowing what I know, with seeing this and going, I wonder if there's a connection here, right? And I see the behavior. I have a master's degree in sports medicine, and really the reason that I talk about that is because I've been on both sides of the healthcare spectrum. So obviously I'm a chiropractor, right? And I work on the alternative care model, but I've also worked alongside orthopedic surgeons and physical therapists and athletic trainers. And so I kind of know how that side of the spectrum of the healthcare model works. So I think it just gives me a little bit different perspective. And I think there's fantastic things that can come from working together there. Now I've been a chiropractor for over 10 years now, and in chiropractic, you think of chiropractors as somebody who adjusts the spine or cracks the back, right? But what I've been able to do over the last several years is to do some advanced clinical and seminar study on functional endocrinology and functional neurology and things like this. And without going into a great detail, functional has to do with function. How is this body functioning? And the reason I bring that up is because traditional healthcare, as I've seen it, the allopathic model is you show up with a symptom and you go in and you talk to a doctor, and the doctor may run some cursory testing. Usually that cursory testing is what the insurance company will pay for, and usually it's pretty surfacey, and you may come out of that and with a diagnosis. And a diagnosis is simply a label that is paired up in a big giant book with a drug. Now, if that's not what you understand about how that system works, that's how I understand it to be. And so then you leave there typically with a drug. So functional medicine says, hey, what's the cause? What's the driver behind why you have these symptoms? Because there's always a cause. Okay? God did not create you with a lack of an SSRI drug in your system. Okay? Yes, people have depression, and there are times when they need that drug, but there's something else that's driving it. Does that make sense? So we got to find out the functional part of it, and we do that through a lot of lab testing. I happen to be able to consult with it's actually over 400 different doctors around the country now who do functional medicine, and we're on a message board together. So the reason I highlight that is because if I don't know what's going on, or if I don't understand something, I can get on this board and I can actually communicate with somebody and have answers within a few minutes from somebody who maybe has been doing this for 30 years. And so it's special. It's unique. So our goal here tonight, and my assumption was that you're here in relation to children. Okay, if my assumption's wrong, I apologize, but it is to reinvent your child's life first and foremost. Okay, and then number 2 is to make a maximum positive impact on your child's life from this day going forward. Whether you choose to do something in our office or not, there's things you're going to learn tonight that you can apply immediately that would change your child's life or somebody you know. And then number 3 is to provide an exit strategy. An exit strategy from maybe drugs, from behavior problems, maybe from the worry about how is my child going to get through school if they're having a learning disability. Okay, these are exit strategies that we hope to help you with tonight. A couple of ground rules that I like to talk about. Number 1, you've got to be willing to make a lifestyle change. Okay, there is no quick fix. Ritalin will work in the short term in some kids, but in the long term, it's a class 3 psychopharmaceutical narcotic drug, basically, right? It's heavy duty stuff. It's like cocaine. Adderall's the same way. I don't know if you know this. If you know somebody who's been on Ritalin, that you cannot be in the military if you've been on Ritalin. It's that hard. Okay, so there's got to be a lifestyle change, and the lifestyle change typically means dietary changes, okay, and some other things we'll talk about. You've got to take personal responsibility for you and your child's life. What I mean by that is that your insurance company doesn't care, frankly. The government is not going to make that change. I think you know this, but I get people who come in here all the time, and the first question is, "Well, doc, is my insurance going to cover this?" And the answer is no. And then they leave sulking, and it's like, I'm sorry, they don't pay for health care. Okay, they pay for the bare minimum of sick care. They don't pay for health care. So let's jump in a little bit and talk a little bit about neuron theory. What does this mean? We're talking about brain function here. We're talking about what does it take here for proper nerve system function. Okay? We know that the autism spectrum, ADD, ADHD, dyslexia, these are neurodevelopmental disorders. Okay? This is brain related. With the brain, you need two things for it to function properly. The first is fuel. And fuel can be broken down into oxygen. Your brain needs a lot of oxygen, particularly your cerebellum, which is that big hunk of cauliflower-looking stuff in the back of your brain, okay? And when your body is depleted of oxygen to the cerebellum, it won't fire. When I say fire, I mean stimulate the frontal lobes of the brain properly. And we'll talk more about this. The second is blood glucose, or your sugar levels, okay? This is really important because if blood glucose levels aren't supported properly, and you are somebody, or your child is somebody who goes through these spikes and dips all day long, and they're irritable and lightheaded if they miss a meal, or they are fatigued after meals, these are signs of dysglycemia. That means abnormal blood sugar control. And this will sabotage your health faster than almost anything. Okay? One of the things, back up to oxygen, one of the main things that causes you to have low oxygen is due to anemia. Okay? We see this in kids. We see this in all ages of people. Right? So anemia. The second thing is activation. What I mean by activation is what activates your brain. Now, your brain is actually activated by movement. When you walked in here today, just the act of cross-crawl motion was actually firing messages up your spinal cord to your cerebellum, and then, if it was the right cerebellum, it fires to the left frontal lobe, okay? That's supposed to happen. So in these kids, as we'll talk about, and in adults, there's a misfiring that's going on there, or slow firing. So if we can find ways to activate that brain, okay, with certain therapies, then that's going to help them recover much faster, okay? So how many of you know how the brain is affected? Does anybody know with autism spectrum disorders? Do you
mean like the physical part of the brain, or just like the functioning of it?
Yeah, both.
Oh.
Yeah, like what side of the brain do we typically talk about is not working the way it should?
The right side.
You got it. It's the right brain. So you just answered that question. So we can look at this. I kind of put a little picture here together for you to look at left brain, which left brain almost always is that's where dyslexia falls in. It's a left brain issue. Okay, but when we start talking about right brain issues, we start to see ADD, ADHD, other behavioral things. Okay? Do you know what is much more complex than this, but what primarily activates the right frontal lobe? It's the left cerebellum. It's a mechanism of it's a cross. Okay, it actually goes from left to right, from the back of the brain to the frontal lobe here. And then what's supposed to happen, and I don't have a fancy picture, but what's supposed to happen is that if I move my arm here on this side, okay, all of these little joint position receptors that are in here, they're called proprioceptors or mechanoreceptors, and they're constantly feeding information to the left side cerebellum. Okay, now I move it, and just by doing this, I have just bombarded my left cerebellum with a ton of information. Now, if everything's working correctly, now that left cerebellum should feed forward mechanism to the right frontal lobe. Then what should happen is that the right frontal lobe should actually activate or send signals down to what's called the lower brain stem. Okay, I don't expect you to remember this, but it's where the pons and the medulla are. Okay. Then what's supposed to happen is that the lower brainstem should send a message up to the midbrain area, the upper brainstem, telling it to calm down. Okay? So what happens if you can't put on the brakes? Now you've got an overfiring midbrain. It's left unchecked and it's like this. It's just going crazy. And by the way, this is the same mechanism that's often a culprit in fibromyalgia. People who have chronic pain syndromes where it seems like one day you're doing great and then all of a sudden the next day you've got pain in all these different places. Migraine headaches, okay, common for the midbrain to be overfiring. Attention deficit issues, overfiring midbrain. So if the problem is way back, the problem could be way back at a joint that's not firing to the cerebellum. The problem could be at the cerebellum not firing to the frontal lobe. It could be the frontal lobe not firing to the lower brainstem. Do you see how that can be complex, right? So we're talking about neurodevelopment disorders, and they call it functional disconnection syndrome. And some of you may have read the book by Dr. Melillo. Have you heard of the book? Okay, Dr. Robert Melillo is he's actually a chiropractor. He's done what he does is brain-based therapy, and he studies with a guy named Dr. Carrick, who is the world's foremost chiropractic neurologist, who I've trained under, and that's why we do what we do here. But he's written a book about functional disconnection syndrome, and as you can see from here, right brain functions include things like holistic thought and intuition, creativity, art and music, and this is decreased in the spectrum. Left brain functions have to do with analytical thought and logic and language. Okay, and those typically are doing pretty well. But what we have now is a brain that's not balanced. We have an imbalanced brain. Okay, so if we create balance, does that make sense that might help? So most kids now are being treated, maybe I wouldn't say most, many kids that we see now, they are being treated with powerful drugs, powerful psychoactive drugs. And we know that these are not treating the child. They really are just covering up a symptom. They're providing a biochemical in hopes of treating the issue. But if you just took that kid off that drug, at some point, since the underlying cause was never addressed, these problems are going to come back. It's no different if you have a hypothyroid. It's no different if you have fibromyalgia, chronic fatigue syndrome. It's all the same stuff, frankly. It's not getting to the cause. So something that I like to highlight here is that we know that we have in our body 4 main barrier systems, okay? And we have what's called the gut membrane barrier. We have a barrier in the lungs, things that we breathe in. We have a barrier in the brain. It's called the blood-brain barrier. And then we actually have our skin membrane barrier. And what we're seeing here in these is that one or more of these immune barriers are compromised. And this is in kids who have behavior issues and attention problems, but it's also in thyroid issues. I say that because thyroid is so common. You all know somebody who has a thyroid issue. And the most common cause of a thyroid problem in our country, that they have hypothyroidism, is an autoimmune issue. Their gut-brain membrane has been breached. We'll talk about that here in a second. So think of it like a screen door. So if you're going to walk out on your deck and you've got one of those sliding screen doors, right? Well, that's a barrier to keep what out? Bugs, right? Yeah, birds. We have a crazy robin at our house who, I don't know, I just got to tell you this, I don't know what happened, but he sits on our the post, I guess the rail, thank you, of our deck, right outside our breakfast table window. And this robin, I don't know if it thought it lost its mate, I have no idea. Every morning, it just head first into the window, over and over and over. You should see the mess. You know what mess I'm talking about. Everywhere. So I don't know what's going on. Anyway, he's trying to get into our group. Thankfully, we have this barrier that's not been breached yet, right?
When is he going to die from doing that?
I know. It's probably got a severe head injury at least, right? But now if you get a rip in that, like my kids who inadvertently pushed through it, right? Now it's open, so bugs can get in, right? Well, it kind of goes like this. And this is kind of how, this is one way that you can get a breach in that gut barrier, which is one of the first places that your immune system gets involved. And let's say that you have antibiotics. Now a lot of kids, they start out their life with antibiotics because they had ear infections, right? Doc, my kid's got an ear infection. Well, here's another round of antibiotics. And I hear kids, by the 2, they've had 5, 6, 7 rounds. So what happens? The antibiotics don't just kill the bacteria in the ear, it kills everything in the whole body because they don't discriminate. Now what can happen very commonly is that the yeast that is normally in there, that's in a nice balance, gets out of balance. And kind of like the bugs that start to get through your screen door, they start to can eat little holes. It's a little more complex than this, but your immune system is now involved. And the immune system job is to take out the intruder at whatever cost. Okay? It's kind of like the police force. If you've got an intruder in your house, you call the police, right? And the police come, and their job is to get rid of that intruder no matter what the cost. Well, sometimes it doesn't go as planned, and you start to get collateral damage, right? The same thing happens. The immune system will mount an immune response against that bacteria, and next thing you know, you've got this full-blown inflammation in the gut. And this now starts this process of leaky gut syndrome that we call, and you get undigested food particles that can get into the bloodstream. They're not supposed to be there. Only microscopic nutrients are supposed to get through there. Okay? And the immune system is on high alert. Just by analogy, when we talk about digestion, this is representing, the whole chunk of food here, and when the digestive system starts to use enzymes to break it down, you've got different sized particles here. Only the smallest of these nutrients is supposed to get through that gut barrier. But what we're finding is that quarters are getting in, all right? Now you've got even more of an immune system reacting. Where am I leading with this? The gut and the brain are intimately connected. Matter of fact, there's been a book written by an MD called The Little Brain. It's about the gut. The gut has more neurons than the brain does. 90% of your serotonin, which is your feel-good chemical in your brain, right? You've heard of serotonin. 90% of it made there, okay? Your gut, you cannot think about your gut in the same light anymore, that it's just a place to digest food. It's your main immune system. It's your immune system, and it's also called your little brain. So, the idea is that only the nutrients are supposed to get into the bloodstream, and then they circulate to all the cells and tissues. So that's good. But what we see happening in these kids and adults who are on the spectrum is that over time, this gut barrier here, these are the cells of the small intestine, okay? They start to get broken down. You've got intestinal barrier dysfunction, you start to develop food allergies and intolerances, you start to have immune system abnormalities, autoimmunity, which simply means your body's attacking itself. And most of the chronic conditions that I see in my office now, they're autoimmune. That's the underlying issue. And the ologists say that once autoimmune, always autoimmune. Well, if you're going to be autoimmune, then let's do whatever we can to subdue the immune system so it can stop attacking your own tissue. Does that make sense to you? That makes complete sense to me. Okay, that's getting to the cause. What is driving the immune system? Is it a food? Is it a critter? Okay, we find parasites that could drive this even. Pinworms, we find that in kids a lot. That could drive this immune system. So this ends up causing what we call the leaky gut, the leaky gut syndrome. Okay. So the body has mounted an immune response and it's beginning to attack your own body tissues, in addition to the antigen which it's trying to get rid of. So it's kind of like collateral damage. Well, let me back up a second and say this when it comes to the thyroid, because it is so common. And just to give you a quick story, I have a young lady, 9 years old, who started coming to me 6 weeks ago, I guess. She's 9, and her main complaint when she came in, her mom's complaint for her was depression, anxiety, ADD and ADHD. She was withdrawing from her friends, where she had been very social. She was a dancer. You look at her and you go, wow, this girl is fit. You know, she's not overweight. Sweet kid. And we ran some blood work, and we ran some food sensitivity testing, and we found out that she had a severe gluten allergy. She had been tested, by the way, by her MD for gluten, but see, they only run one little piece of gluten. They run what's called an IgA to alpha gliadin. I won't go into detail about that right now, but they didn't run all of the pieces to find out if it was a gluten issue, so she did. So anyway, she's got a leaky gut, is what it came down to. So she started doing brain-based therapies here. We put her on an anti-inflammatory diet, and we had to give her some outside supplementation to help heal that leaky gut. And literally within 2 weeks, she's a different kid. 2 weeks! And I mean, this is how quickly these things can come around. So now she's back with her friends. She's happy. She's coming in. She's smiling. It's cool. So just to reiterate, so we get this immune response. It ends up leading to this leaky gut, which ends up leading to what we call leaky brain. They call it leaky brain syndrome now. So this gut-brain connection is real, and that brain barrier gets breached, and now you start to get inflammatory issues in the brain as well. And you have these chemicals called cytokines that are byproducts of inflammation, and they start to mount in the body too. It's this whole process. Neurotoxins can pass through freely, and you get collateral damage. I don't want to beat a dead horse, but I just want you to really understand how critical this gut is. So we're going to talk a little bit now about how this whole gluten thing works. And, you know, how does this, what is it, how does it affect people? And we know that it's not just wheat, right? It's spelled, it's most oats, unless you find the oats from a gluten-free facility. It's rye and it's barley. Kamut. Okay, most people don't really eat kamut, but some do. And then there are all these hidden sources. So people say, well, I'm gluten-free, doc, but are you having soy sauce? Well, yeah, but it doesn't. Guess what? Food starches and emulsifiers. By the way, emulsifiers, if you drink red wine, unfortunately, of most red wine, they use an emulsifier that's a gluten-based product. So you think you're okay with that. So you actually have, if you have a gluten issue, you actually have to find a gluten-free red wine. White wine doesn't have it. Food stabilizers, artificial food colorings, and so on. How does this breakdown of gluten work? So gluten in itself is a large molecule, and what we're really talking about when we're talking about gluten sensitivities, we're talking about gliadin. Okay, gliadin is the protein. Glutenin is the opposite side, and glutenin is the part of the wheat molecule that is where they get the sprouted grains from. Okay, so the Ezekiel bread, and things like that that people eat. Unfortunately, they're finding now that some people are reacting to that as well. So you may not be safe with that. But I highlighted alpha gliadin because this is the test that most doctors run. And you come back negative and they say, oh, you're fine, you can have gluten, no big deal. But what if you're reacting to beta, gamma, or omega? Okay, so you could be eating and it's still sabotaging your gut function and brain function. But the way this is supposed to work is when you eat it, it's broken into gliadin and glutenin. And then, see, gliadin is too big to be absorbed. So you're supposed to be able to break it down with these enzymes. And an enzyme is called a transglutaminase, so that it can actually be absorbed through the small intestine. Okay? But some people, as we said, it looks like a foreign protein. It almost looks like a bacteria. So the body attacks it. Now, I mentioned earlier that autoimmune thyroid is really common in our country. The #1 driver of an autoimmune thyroid in our country is gluten. Because gluten, from a molecular standpoint, looks almost identical to an enzyme in your thyroid. So the body attacks the gluten, and then it begins to attack this enzyme in your thyroid. So transglutaminase now, it breaks these gliadin and glutenin into deaminated gliadin. Why? What's the point of that? Well, they use it widely to help food last longer. So this deaminated gliadin is in all this stuff to extend the shelf life. So what's the takeaway from this? The gluten-free section of the store is not equal health. Okay? If you look at the package, the label on gluten-free products, many of them, maybe most, and you find it like Cub and the other stores, it's full of other stuff that you don't want to eat in your body. But it looks fine to you. So what happens when someone is gluten sensitive? Well, first you have a genetic profile, then exposure to gluten, which causes your body to react. Okay, so you have this genetic profile. Now, there's such a thing as celiac disease, and then there's non-celiac. We'll talk about that in a minute, but it's estimated that 25 to 40% of the U.S. population has either one of these two genes that lead to celiac disease. Celiac disease is a genetic disease where you cannot process gluten, and it actually begins to break down that gut barrier. Okay? But the prevalence of celiac is only currently estimated at 2 to 4% of the U.S. population, but likely it's much, much higher. But what we are seeing and what we're finding out is that people are, there's way more people that have what's called non-celiac gluten sensitivity. So they go to the MD. The MD runs that one test that we talked about earlier. It's negative, so they say, well, you don't have celiac. But the true test of celiac is you have to have three things. You've got to have the deaminated gliadin, the alpha gliadin, and then they run a tissue biopsy where they literally go in, pull out a plug through a surgery of your small intestine. And they look to find out if the little microvilli, which are the finger-like projections, okay, if they're worn down. So here's shag carpet, here's Berber. They want to see if you have Berber, right? Well, they'll run this test and they find, oh no, you're fine. Well, one of the problems with that is that small intestine is really big. What if they only want one little area? What if they miss it? So you got to do the right testing. That's what I'm getting at here. You've got to run the right tests, and I'll talk about those. But how does this work? The outcomes of gluten sensitivity. So you get exposed to it, and then you have an immune reaction. Now there's two things that can happen. One, you can have it without, this means enteropathy means disease of the enterocytes. Those are the cells of the small intestine. So you can have it with or without disease of those cells. But even if you don't have that tissue breakdown, you can have tissue inflammation. Here we go. Here's brain. Brain, we're talking about autism spectrum here. We're talking about ADD and ADHD. Also, you can have tissue autoimmunity. And then you can have it with the breakdown, which we talked about. That's celiac disease. Okay. Here's a big complex picture, but a healthy response in the gut to gluten is that you eat it, and it basically gets broken down the way it's supposed to. Your enzymes work fine. You control the immune response. But in celiac disease, I don't know if you can see this very well, but you've got these finger-like projections here. That's healthy. And here is the unhealthy part, where these cells have been broken down. The shag has been broken down into the Berber, and now you've got all kinds of food proteins, particles, bacteria, other things are flowing into the bloodstream, carried through the system. Here's a gluten intolerance reaction, where you don't have celiac disease. You don't have a breakdown of that villi, but it's still getting through. The gut is supposed to have a very tight barrier there. It's supposed to be really tight. Remember, I said it only allows micronutrients. So now large things are getting through there. You start to mount an immune response, and now you've got multiple organ system disorders. Brain, ovary, kidneys, autoimmune, type 2 diabetes. Okay. And this is just another picture of another way you can have an allergy reaction. But gluten sensitivity as a neurologic illness from the Journal of Neurosurgery Psychiatry, patients with disease of the intestinal tract represent only 1/3 of patients with neurologic manifestations and gluten sensitivity. So we've got way more people who have neurologic issues but have normal looking gut via biopsy. It means that 2/3 of the population with the gluten sensitivity have no intestinal destruction or symptoms. So these are the people that can be kind of, they walk in and I tell them, you've got leaky gut. But doc, my gut's fine. I don't have any digestive issues. Yeah, but that barrier's been breached and now it's affecting your brain. 87.5% of the people with celiac disease, they have a positive biopsy test, but they have no symptoms. So it's really only the tip of the iceberg of the people who actually have symptoms of celiac disease that actually have it. So, I mean, this is a room where there's, what, 7 of us here? If 2/3 of us potentially have this and have no gut symptoms, to me that's, that's worth exploring. It's worth looking into. For every symptomatic patient with celiac disease, there are 8 patients with celiac disease, no GI symptoms. I'm getting somewhere with this. Okay,
so
what our main
symptoms,
topic
or they're
is.
completely asymptomatic, are you saying?
It could be either or, but in many cases it's other symptoms, and they have, and it runs the gamut. And here's what we're talking about. Okay, they can have some of these, but we're talking about back pain. I mean, back pain doesn't have to come from the back. It can come from abnormal GI function, but you don't even know you have it. Diarrhea, energy loss, fatigue, gas, mouth sores that heal for a short time and they come back. Heal for a short time and come back. Okay, she's nodding like maybe you know about that. Tooth enamel defects we find in there. Guess what? If you have bad teeth, you've got bad organs. The teeth are intimately involved with your organ system through meridians. Okay, it's crazy. We find that when people have heart disease, oftentimes they have periodontal disease as well, and they don't even know it. All right? If you've had, this is a side note, if you've had a root canal, it's one of the worst things, in my opinion, that you can do for your health, because a root canal kills the nerve. And what you have left is hundreds of miles of little tiny crevices in that tooth where bacteria hide out. And that tooth is related to two different organs.
So if someone has had a lot of root canals, is there like a certain thing causing that, like linked to this kind of stuff, or is that completely different?
Why they have the root canals?
Yeah, like I have a friend my age who's had like 3 root canals in the last 2 years.
Yeah.
Or I don't know root canals, but a problem with.
Yeah, very well could be. It very well could be that she's got some kind of a bug elsewhere. Yeah, and it's really interesting. But each tooth has associated organs. Some of the teeth will overlap with certain organs, but
I know people with celiac that have really bad.
Yep, really bad
teeth
teeth.
stuff going on.
You got it. Yeah.
Lots of.
Yeah. So when it comes to root canals, a lot of the biological dentists that I know and have kind of tried to learn from, they don't even recommend root canals. They just recommend just pull that tooth and actually clean out that socket really well. Yeah, because you'd be better off doing that in the long run. Other associated conditions that can happen with this gluten issues, amenorrhea. So women, they lose their period. Well, how did that happen? You've got a gluten issue. Iron deficiency, B12 anemia, and it goes on. Hypothyroidism, infertility, autoimmune, chronic fatigue, and so on. Symptoms in children now. So we can see where they're slow to develop. We get this failure to thrive. You start to see that they're not gaining weight when they should be. Projectile vomiting that is often, we're often told that is just due to colic or due to, they're spitting out. It's a phase, they'll grow out of it. The kids are cranky, as they get a little older, difficulty concentrating, irritable all the time, personality changes, obsessive compulsive. I have another young lady who has a disease called trichotillomania. Okay, she pulls her hair out. That's what she does. It's an obsessive compulsive disorder. She's got a massive gluten sensitivity. So we took her off of gluten and other gluten grains, wheat and other gluten grains. Took her off all grains, actually. Took her off all dairy. We put her on a strict anti-inflammatory diet. We've done brain-based therapy with her, and her hair pulling has stopped tremendously. It's still happening, but she's got multiple food sensitivities, not just gluten. So it's going to take some time. She's 11. I mean, it's crazy. So in the past 50 years, celiac disease went from 1 in 700 to 1 in 100. So why? Why is this happening? People always ask, well, why is this happening now? Well, some of the possible reasons are because of genetically modified foods. So there's companies, big companies, that are actually changing the genetic structure of these foods like wheat. Why? Because they want to make it last longer. Okay? Let's say that a farmer harvests wheat and they put it in a silo and the wheat market is real low, they might let it sit for a year or two in the silo, growing all kinds of nasty stuff on it. Okay, so they're genetically modifying so it has longer shelf life and whatnot. We talked about the deamination. Just mentioned the gluten storage in bins. Leaky gut, of course. Chronic stress. Do you know that when you have chronic emotional and mental stress, that it causes what's called secretory IgA, which is like, I think about this as your slime layer, but it's a good slime layer that covers all of the cells, all the villi in your small intestine, okay? So when that secretory IgA layer, that slime layer, gets broken down, now you've got access, easy access to start breaking that down. That is your first line of defense. That stuff starts to get broken down within 20 minutes of a person being angry. Isn't that crazy to think about? So people who are chronically angry, really bad, okay? Of course, poor nutrition and then enzyme insufficiency. Impacts of gluten sensitivity to health. We talked about associated autoimmune antibodies, thyroid and pancreas. Psychiatric illness has been observed to be one of the main causes here. Okay. Currently, the labs only perform the gliadin antibody testing. Well, this is where we end up with all these false negatives. People are told you're just fine, and they're not. So, and then I hear people come in and say, like, my doctor tested this. Why am I still suffering with this? I've had all these tests done. Well, most labs only test the alpha gliadin, which I talked about, right? But there are lots of other pieces of a wheat molecule that you could be reacting to. And I like to think of it like this. You know how Chinese letters are kind of, there's lots of lines? You know, a Chinese letter, I don't know Chinese, but you know, I think of it as, let's say that there's 3 letters like this and there's one that goes across like that, right? So each of those lines of that Chinese letter, individually, your immune system could be reacting to it. It may not react to the whole molecule, but just to one piece of it. So that's where it gets kind of complex. So if you don't run the right test, you could miss it. We use a lab called Cyrex Labs. Okay, this is one of the best labs in the world for neuroimmune issues. And they have 3 different tests that we like to use. One is a saliva. It's kind of a screening. It's kind of good for kids, but what it does is it's sensitive at picking up a gluten sensitivity, but not to what aspect. In other words, it won't tell us if it's due to alpha or gamma or beta or what it is. Array number 3 is one of my favorite tests, okay? Because it looks at 2 different immunoglobulins, immunoglobulin A and immunoglobulin G. And it looks at 11 different aspects of immune response, and it can also tell you if you may be having an autoimmune reaction to skin, to nerve, or to bone, okay? So before you even have any symptoms of a nerve issue, for example, you can pick that up. So it's a really nice test. And then, don't forget about gluten cross-reactivity. So what's this all about? We now know that there are multiple foods that look enough like gluten that the immune system will react as if it was gluten. And it includes these: dairy, including milk chocolate. It includes coffee. Coffee is the #1 cross-reactor with gluten. So I have all these people coming in with an autoimmune thyroid, right? And I tell them, guess what? You're going to have to get off coffee. And what do you mean? I can't do that. Well, do you want to get better or not? Rye, barley, and spelt, oats, yeast, millet, amaranth, sorghum, tapioca. Tapioca is in everything, by the way. It's a tapioca starch. They put that as a thickening in all kinds of stuff. Buckwheat, quinoa. We've all been told quinoa is safe, right? That's a great grain for you, not for some people. Sesame, corn, rice, and potato. And you start to think, what can I eat, doc, right? What can I eat? Well, this test is nice because it can tell you. It'll tell you if you're having an antibody reaction to one or more of those foods. And what's the best thing about it is that it helps us to know, hey, what's going to happen with my diet going forward? Okay? I've not run across anybody who had an issue with every single one. But I have had many people who've had 20 plus. Yeah, very restricted. So if you have confirmed, or your child, for example, has confirmed gluten sensitivity, You can't eat it ever again. Period. You can't. Because you have circulating antibodies, which means your immune system will recognize it immediately and immediately begin an all-out assault. And it's not just a little attack. I know people who have been gluten-free for 2 years, and they go to a restaurant and something small just slips through, and they have an autoimmune reaction that lasts 6 months. I mean, it's pretty crazy. So I don't mean to scare you, but that's how serious this can be. And so if this is happening and causing autoimmune conditions, can you see how this might affect the brain for these kids who are having developmental delays and attention focus problems? Absolutely. Some, as I said, of the unhealthiest food in the gluten-free section of the food store are the ones that say gluten-free. They're unhealthy. They're full of cornstarch, high fructose corn syrup, and other things. I'm going to pass further. For 4 main reasons why gluten-free diet may not be effective then. 1, because of hidden exposure. You don't know what's in there. Number 2, you've got cross-reactive foods. All right? Like this person. Doc, I can't understand it. I'm not eating gluten. Are you eating any corn chips? Oh, I have a bag a week of that. You know, big bag, right? The one. Well, if you're reacting to corn, guess what? You're going to have the same reaction. Unresolved leaky gut syndrome and then other autoimmune issues. So why do I say this? Why am I talking all about this now for the last 30 minutes when we're supposed to be talking about ADD, ADHD, and gluten? Okay, because in almost every case, if not every case that I've seen of dealing with kids and adults who have these problems, we have to run the right lab work to find out what is driving this. And there may be food issues, but oftentimes there are other underlying metabolic conditions that are happening as well, like anemia. And if you have anemia and it's not addressed, you're never going to get better. Your child is never going to get better. Here's another thing, just to add insult to injury. There is something called, have you heard of gluteomorphin or casomorphin? Okay. You see the morphine part of that? Morphine is addictive, right? Okay, it's an opiate. Well, in some people, when they come off of gluten, they will go through a withdrawal as if they're coming off of morphine. Or if they come off casein, which is the milk protein, they come off it and they will literally, I've heard of people, kids more so, who've ransacked their house, tore everything out of the cupboards looking for gluten. Almost like that, they need their fix. They need their fix. It's pretty intense. And so, I tell people, don't take this lightly when your kid, especially a child, is coming off of that, and they're having hyperactivity problems, behavior problems. For a couple of days, it may be pretty touch and go for you, but you've got to stick with it. You've got to, and I say this later, you've got to be willing to crawl through glass to help your child. Otherwise, it's like giving them more morphine. Okay? So back to the brain now. The right frontal and right parietal lobe malfunction in autism spectrum disorders. Okay? We talked about that. You guys already knew that. Leading to decreased firing of the right brain. And we talked a little bit about the two sides of the brain here, but just to reiterate, right frontal lobe, big picture. Okay? Whereas left frontal lobe is more about details. Okay, my wife, she's detailed. I'm big picture. Okay, I can plan for the future, but she knows exactly what's happening step by step. Nonverbal communication versus verbal, and so on. And think of the right brain as kind of like the gas pedal. All right, you push the gas, boom, you get going. The left is like the brake pedal. That's what slows things down. What's happening here is that if you don't have any brakes and you're pushing on the gas, you're going to go off the cliff in a hurry. Okay? So this is what's happening with these kids and adults. They don't have any brake pedal. They have no way to stop it. Their brain is so out of balance. And so what do we see with right frontal lobe problems? We see that they're not sociable in some cases. This is the first girl I told you about. She can't stay focused. Math reasoning starts to go downhill when maybe they used to be better. They do the same thing over and over and over again. They slouch a lot. Any idea why they might slouch a lot? Want me to tell you? Okay, because this is big. Because your cerebellum, remember I said the cerebellum is a relay station from your body? So the left body goes to the left cerebellum? Well, if the left cerebellum is not firing properly, see, the cerebellum is also responsible for spinal postural muscle control. The muscles along your spine that hold you upright. So if you've got a decreased firing on one side, a lot of times we'll see this. One side of the body will slouch like this, and it'll actually internally rotate. It'll rotate in like this. So I can just watch people in the mall, and I'll watch their posture, and they're forward, their head's forward, and they've got this. Why? They've lost all the spinal muscle control on that side. And I can just go, that guy's got a left cerebellum problem. I almost guarantee it. Dude, you need to get that activated, you know? So these kids, they like routine, right? They don't like to change. They don't like to get off course. They lack a response, and so on. Behavioral outbursts, anger outbursts, followed by depressive modes. You'll have the compulsive acting, just out of the blue. Something, what in the world were you thinking when you did that? They're fearful and anxious, okay? And so on. They typically have good short-term memory. So as I said, the brain needs two things. They need fuel and activation. So how can you fuel this kid? One, you got to take out the junk food. No sodas. My goodness. That's going to fuel it like nobody's business, because that's going to cause blood sugar dips and spikes. No donuts. Why? Well, it's full of everything bad. You got to look for these neurotoxins like gluten, casein, soy allergies, and the cross-reactive foods. You need proper blood sugar regulation. Well, how would you know what their blood sugar is doing unless you ran the right test? You got to run the right test. And proper oxygenation in the brain. As I said, you've got to crawl through glass sometimes in order to pull these kids out of it. But it happens all the time. It can happen. We talked about that. We talked about the addiction piece of it. And what I didn't mention was that there's an area in the brain called the nucleus accumbens. All right? This is the area that's associated with pleasure. And it's where you have receptors for opiates. So that's why when you take out the glutamorphin and the casomorphin in these kids, sometimes this area gets affected and they start to go crazy looking for it. So you've got to remove these neurotoxins. Okay? If you did nothing else, if you just removed gluten and dairy and watched what happened, amazing things could happen. You can't give in if you want to change your child. You just can't. And that, unfortunately, as a parent, isn't it hard? I mean, I have a 4-year-old, a 6-year-old, and a 7-year-old. And I don't like to say no to them, you know? But I have to, most of the time, actually. But when it comes to some of these foods, you just have to put your foot down and be an oak tree for your child and say, no, I'm not going to give you this because frankly, your health is going to deteriorate rapidly. And, you know, look, it's one thing to go through life with attention problems. It's a whole other thing to go through life with a gluten sensitivity that you don't know about, or a casein sensitivity that is literally eating and rotting your guts out and leading to autoimmune disease. And I'm not joking about that. It's serious business. So in our recovery program, the way we do things here is that we don't just treat this disease. And your child, they come in, I don't care what the label is, I don't care what the diagnosis is, we're not going to treat that. Every child is different. Okay, that's how we do things here. That's how you have to do it. A diagnosis, do you know what that word means? By the way, di means two. Agnosis means don't know. Two who don't know. You and your doctor. That's what that kind of means. So a diagnosis is simply a term that has been paired up with a drug. That's all it means. Okay? Forgive me, I'm not bashing medicine here. Medicine is excellent at acute care trauma, but when it comes to chronic disease, it's a failure. They don't even want to work with chronic disease because they don't have any answers for it. Okay? And the only answer they have are psychiatric drugs. They're starting, some in functional medicine are coming around. Okay? But that's the way it is. But first step, you've got to remove the toxins, right? Deflame the body is what I call it. And then you've got to repair the brain barrier and the gut barrier. We put people on a gut repair program to heal that leaky gut, shore it up so those nasty things aren't getting through. And then we have to repair the neurodegeneration. So proper food, proper therapies. What does that look like? We have to use therapies that will balance the right and the left brain. Okay, if we just take out the gluten, that's going to be one thing, but if you've got a misbalanced brain there, then that's another issue you've got to deal with, right? So we do right brain rehab. What do we do for that? We do a lot of different types of neurologic therapies that will activate the right brain. Okay, as an example, I might have somebody do large ABCs with their left arm because a large multi-directional movements are firing all of those nerve receptors here up to the left cerebellum. Okay, I might do it in time with a metronome that is at a constant steady beat, and they have to, in time with the metronome, turn their head. Dum, 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 dum. Why? It's massive stimulation of the left cerebellum and right frontal lobe. So we do a whole host of things. We do unilateral adjustments. What does that mean? If you see a chiropractor who's adjusting both sides of the body, and you have a brain imbalance, okay, that's not going to affect it the way it should. We adjust one side of the body when there's a brain imbalance. Okay, balance beam. Sometimes we'll put people on a balance beam to stimulate the right brain. Arm movements, leg movements, eye exercises. There are very specific eye type exercises. Why? The eyes have 22% more nerve function to the brain than any other sense. So if we can elicit good eye motion and movement and stimulation, that's going to power that brain. It goes on down the line here, but we use a whole host of different types of therapies to stimulate that right cerebellum. Again, the left cerebellum is supposed to go to the right brain, and these therapies allow us to wake up those neurons. Okay, it's simply that. It's waking them up. So some of the things that you must be willing to do, or maybe your friend or loved one must be willing to do. One, you must implement recommendations for dietary changes. Otherwise you're not going to get better. Plain and simple. No watching TV over 30 minutes. It's a left brain stimulator. Okay? Creates zombies. No handheld games. Why? Stimulates left brain. How hard would that be to take away the DS, right, from a child? Well, it's hard, but that's where we've got to be the oak tree, right? Removing security or chewy object the child holds. Why? Because that obviously stimulates the left brain as well. No computer. And you have to perform daily exercises that are prescribed specifically for your child, okay, at home. So there's home exercises and there's brain-based exercises here in the office that we do. Okay, so with all that said, I mean that's a ton of information in a short time, I know. And I have no idea if you're here because you have a child who you're interested, wondering about, or if you know somebody, or you're just interested in hearing this. But the way we do things in our office is this. For people that want to come in and just find out what we can do to help them, we offer two first visits. Okay, and here's what happens in the first visit. We do a complete chiropractic and neurologic evaluation. Why? We have to find out what side of the brain. Well, we know in these kids typically it's the right brain, but we got to find out specifically which parts are not firing the way they should. That's what we find within our neurologic exam. We review any existing lab work. So we have people say, we tell them, hey, bring in your lab work because it can give us clues. We review a couple of forms that we have you fill out beforehand. And then on the visit 2, we go through what we found on the exam, the neurologic findings from the first visit. We go through any lab work that we've had done since the first visit. And then if we accept your case, we give you an overview of any further testing that needs to be done. And oftentimes that testing includes things like gluten sensitivity testing, okay, or food cross-reactive panels. Sometimes we have to run a stool test to rule out gut critters, okay? We do an overview of the treatment plan, and then we go through, hey, this is what it's going to cost. So we try to answer everyone's questions in those first 2 visits. What is this about? Can you help me? What's it going to cost? How long is it going to take? Right? Isn't that what people want to know? That's what we try to figure out in the first 2 visits. If you decide, or if you think that you do want to schedule for somebody you know or a child, then I'd say, hey, stick around for a few minutes, and we'll help you do that. We'll help you get scheduled or get the right forms that you need, and then that's it for tonight. So thank you very much for coming.
Thanks for viewing this presentation. As a gift for watching, please contact Vallejo at the number provided here, mentioning this video, and you will receive the first 2 office visits free of charge. That's a $350 value. Whether for yourself or your loved one, we want to partner with you to provide the quality of life God designed your body to live. You can contact us at 952-949-0676. Thanks for watching. We hope to see you soon.